Question: is this ancient remedy actually better than modern medicine for CKD patients? A groundbreaking review of studies compared the effects of ACE inhibitors and ARBs, the most commonly prescribed medications for CKD, against this ancient remedy. And the results? Absolutely shocking. In just 2 weeks, patients treated with this remedy saw a huge drop in their creatinine levels, 14.69 points. So, what we should ask ourselves is, are doctors making the right choice by completely disregarding natural treatments for CKD? Or are we missing out on therapies that could save lives just because they are not marketed by Pfizer or AstraZeneca? Catherine here. I'm a doctor of natural medicine, and today I'm sharing something that could change the way we think about treating CKD. This is a natural treatment that has been scientifically proven to lower creatinine levels by a very large review of studies. Now, before we go any further, let me make one thing very clear. I will never tell you to stop taking a treatment your doctor prescribed. I will never say that the medications your doctor gives you are bad. That being said, medical errors do happen and sometimes the wrong medication is prescribed. But that's a topic for another day. Today I want to focus on natural therapies that are proven to work. Therapies that unfortunately are almost never offered to CKD patients, not because they aren't effective, but because they don't come in an orange pill box. Let's start immediately with the ancient remedy from my thumbnail. This remedy is nothing short of a breakthrough. It's been shown to significantly improve creatinine, proteinuria, BUN, and more, all in just 2 weeks. The evidence comes from a massive review of studies published less than a year ago in the journal Medicine. This review included 30 randomized controlled trials with a total of 3,214 diabetic kidney disease patients. So what they did here was finding studies in which CKD patients were treated with ACE inhibitors or ARBs alone and compared them to studies in which patients were treated with ACE inhibitors or ARBs plus an ancient remedy. Pretty straightforward. And as we can see, it's clear the ancient remedy made a difference. In fact, on average, those who took the remedy had a creatinine level that was lower by 14.69. Now guys, what we must consider here is that this result was obtained in a huge number of participants and that it was also accompanied by improvement in proteinuria, BUN, and more. But of course, anytime I mention a remedy that isn't stamped with a corporate logo, the same comment pops up. Here's what they say. What do they call alternative medicine once it's been deemed useful? Now, this attitude really irks me. Oh, I don't know, Dave. Maybe they call it science. Maybe they call it literally saving people's kidneys. Or if you're feeling spicy, you could call it medicine, right? Here's the thing. I don't deal in alternative medicine. You know what alternative means, right? It means instead of. And if you're out here thinking you can swap out your prescribed meds for essential oils and moon crystals, you might as well start writing your obituary in lavender ink. What they did in this study wasn't alternative. They used the remedy alongside conventional treatment. Because guess what? Complementary medicine works when you use it to complement. It's right there in the name. So what is this magical remedy that had the audacity to actually work? It's called Danshen or Salvia meliorrhiza for my herbalists in the audience. And here's a fun fact about it. In certain Asian countries, this isn't just some back alley tincture. It's the #1 complementary treatment for CKD. You heard that right. It's not alternative. It's just medicine approved by doctors in hospitals. Crazy, right? But don't tell that to the keyboard warriors. They'd rather clutch their pearls and scream witchcraft than read the part of the study where Salvia militariza is literally saving kidneys. Anyway guys, rant over. I bet you want to know how to actually use Salvia militariza as an adjunctive treatment. At this point, this remedy is pretty easy to use. It's usually taken in the dose you see on screen right now, and it's also safe. The only precaution is to avoid it if blood thinners are prescribed. In fact, one of the main benefits of Salvia militariza is its ability to improve microcirculation in the kidneys. This is in part a result of its mild blood thinner effect. But this also means that it can interact with certain blood thinners. So be careful, always consult with your doctor or with a naturopath you trust before taking any remedy. Now, one more benefit Salvia militariza can offer is its ability to lower your blood pressure significantly, mostly by relaxing the artery walls. And this is way more important than people realize. Let's see why keeping your blood pressure down naturally is probably the most important step towards a better kidney function. According to science, of course. Alright folks, let's get one thing straight. If your goal is to actually improve your kidney function and bump those GFR numbers up, keeping your blood pressure in check isn't just important, it's non-negotiable. It's like wearing pants to a business meeting. Sure, you could skip it, but things are gonna go downhill fast. But what do I mean when I say keeping blood pressure in check? Well, according to the latest guidelines for the American Heart Association, which by the way gets stricter every time you blink, you want to aim for the yellow zone, not the green. Nope, the green is like the cover of Vogue, aspirational but not particularly realistic. So let's aim for the yellow zone here, but keeping in mind we want to get there without having to take too many medications, because let's be real, high blood pressure is a kidney's worst nightmare. But here's the plot twist. Some of the meds used to treat it, like ACE inhibitors or ARBs, can also damage your kidneys. Yeah, I know it's bad. High blood pressure is dangerous and medications are dangerous as well. Well, guess what? This crisis hides a massive opportunity for CKD patients. It's true. A groundbreaking paper is shaking up the world of nephrology. And guess what? It turns out that your stage of kidney disease isn't the most important factor in improving your GFR. Nope. The secret sauce is keeping blood pressure under control without becoming a walking pharmacy. And guys, I have seen this happen in person. You see, I am still seeing a patient that was rapidly losing kidney function due to uncontrolled high blood pressure. His GFR was 21 and he was taking 5 different medications for his blood pressure. I mean, 5 meds just for blood pressure. He probably needed a separate suitcase just to lug them around. Bet the TSA agent wonders if he's running a small pharmacy. Anyway, everything changed when we started working on his lifestyle, diet, and supplementation. Not just his blood pressure improved, he was able to go down to just 3 medications. His GFR started to improve as well. Last time I saw him, GFR was 27 and I'm expecting him to get even better. So the question is, what can you do to keep blood pressure in check without having to take several medications? Well, certain lifestyle and dietary changes, of course, plus a few very effective remedies. Exercising regularly is one of the most effective ways to do that. According to studies, regular exercise is even more effective than taking prescriptions in treating hypertension, especially because, and not many people know this, exercising also works to lower blood pressure in people who are resistant to most BP medications, just like my patient was. That's right, guys. 30 minutes of exercise a day is basically like firing your BP meds and hiring a personal trainer for your arteries. And here's a wild idea. Pair that exercise with a healthy, low-sodium plant-based diet. Toss in some high-potassium fruit and veggies if potassium isn't an issue for you. And you've got a recipe for success. Just remember to always start slowly. And of course, for some patients, this is not enough. So what I would recommend is to also look into certain supplements that have been found to help. Let's talk about omega-3s. These little wonders have been shown in randomized controlled trials to lower blood pressure by up to 3.8 over 3.1 millimeters of mercury. And the cherry on top, they also tackle proteinuria and inflammation. And even better, there's really no reason not to supplement omega-3s. Something that could be even more effective is magnesium. A shocking number of people are deficient in this essential mineral. And guess what? That deficiency could be the reason your blood pressure is acting like a teenager, moody and unmanageable. Magnesium can also help with insomnia, anxiety, and even muscle cramps. Now, if you want to start supplementing magnesium, make sure you are being tested for magnesium levels. This mineral may accumulate if CKD is advanced, which is a problem. There is also a tea I want to recommend here that is giving huge results in terms of blood pressure lowering and detoxifying effects. This is a special recipe made with hibiscus and ginger, two remedies that have huge benefits when combined. If you want to know more, please watch my video about them. It's up here and also down in the description. Okay guys, let's talk about the big D. No, not that one. Diabetes. The one that threatens your kidneys more effectively than your mother-in-law threatens your peace of mind. Because when it comes to kidney health, there is no improving if we don't stop the cause of the damage. We've just seen how to deal with high blood pressure, but it's not a secret that close to 1 out of 2 CKD sufferers has diabetes, and we need to deal with that also. Now, luckily, diabetes medications in general are not as controversial as blood pressure medications, but they still have side effects. For example, metformin is safe for the kidneys, but it can still accumulate in the blood of patients in the advanced stages. And then there are SGLT2 inhibitors that have kidney protecting properties at the point that they can be used even in CKD patients without diabetes. I'm talking about Farxiga, for example. Now, Farxiga is safe. Kinda. Because it can also give you the world's worst UTI. Yeah, kidney friendly doesn't necessarily mean bladder friendly. Anyway, worst issue with Farxiga seems to be the loss of GFR many patients experience when they first started. So, not nearly as bad as blood pressure medications, but it's clear that the closer we can get to a normal fasting level without medications, the better. So the question is, what can be done to beat diabetes naturally? Just like for high blood pressure, lifestyle and dietary choices are what really matters here. Yeah, drugs can help, but no drug can send diabetes into remission alone, not even Ozempic. You still need to do your part, and learning how to eat correctly can really make a difference. And there are also supplements that can help. Berberine, ACV, ALA, they can all make a difference. But there is a supplement in particular I want to mention here, chromium. So, chromium is an essential trace element we can get in small doses from foods. Essential means that the body needs it but cannot produce it. So, you need to have some of it in your diet just like a vitamin. Now, chromium deficiencies are pretty common at the point that supplementing this mineral has been observed to reduce insulin resistance in general. And here is the good news. Chromium is usually safe in stage 3, especially in low doses. Now, I would recommend more caution in stage 4 and 5. Case reports of chromium-induced kidney injury exist, particularly at high doses and when the supplement is taken for a long amount of time. So only use the lowest possible dose of chromium and only for a brief period of time, and you should be safe. And most importantly, since chromium only helps if a deficiency is present, only use it if it's effective. Think about it. If you take chromium and it doesn't help with blood sugar control, you probably do not have a deficiency. So monitor your blood sugar levels constantly, and if you see this remedy doesn't make a difference in a few weeks, then it means it's not for you. And of course, when dealing with CKD, especially if type 2 diabetes is also present, the first resource should always be the diet. The renal diet is probably the most important step of them all when it comes to stopping and reversing the decline of GFR numbers. As I was saying, there are many documented cases of patients reversing kidney disease only by following a simple renal diet. In fact, if you want to learn about the results you could get with a renal diet, my video up here is for you. And this is all for today. Thank you for watching. God bless you all. Bye-bye.